Hello, my name is Dr. Michael Corey, and I want to welcome you to our Peripheral Neuropathy workshop. In this workshop, we're going to talk about peripheral neuropathy. We're going to talk about what peripheral neuropathy is. We're going to talk about the causes of peripheral neuropathy, and we're going to also talk about our innovative treatments that we've been successful with helping these patients overcome this debilitating disease. Now, first of all, let's just discuss what peripheral neuropathy is. Peripheral neuropathy is a peripheral problem, meaning a problem with the nerves that carry information to and from the brain and spinal cord. So from the midline, from the brain to the spinal cord and out the peripheral nerves. Now this can produce a loss of sensation, it can produce inability to control your muscles, and in addition it's very, very debilitating and it's progressive for the most part if you don't do something to correct the underlying cause. Now peripheral means further out from the center of the body, distal from the brain and spinal cord. So we've got the brain, we've got the spinal cord passing through the vertebra, and that's why it's important. I'm a chiropractor, we're going to talk about the vertebrae themselves, but neuro means nerves, and pathy means abnormal. So we have abnormal condition of the peripheral nerves. Now, in our quest to understand peripheral neuropathy, there's 7 signs of peripheral neuropathy. We have numbness, we have burning sensation, we have cramping, we can have sharp electric pain, we can have pain and difficulty with walking, difficulty sleeping because of the pain, it wakes you up night after night, and we can have prickling or tingling sensation in the hands and the feet. Now, as we look through our description of peripheral neuropathy, we see that the symptoms depend on which type of nerve is affected. Now, the 3 main types of nerves are those that carry sensation, meaning your sensory, what you feel from your environment, those that control muscles, or the motor system, the ability for you to reach, to move your joints and move your muscles, and those that carry information to organs and to glands. So those are unconsciously controlled, and we're not acutely aware of that on a day-to-day sensation. But these sensation changes will cause damage to the sensory fibers, resulting in changes in sensation, burning sensations, nerve pain, tingling, numbness, or an inability to determine joint position sense, all which controls and will complicate your ability to have coordination within your muscle groups. For many of these neuropathies, sensation changes often begin in the feet and progress towards the center of the body with involvement in other areas as the condition worsens. Now, diabetes is a common cause of sensory neuropathy. Now, damage to the motor fibers, on the other hand, interferes with muscle control and can cause weakness, loss of muscle function, loss of dexterity, sometimes cramps, and a sign of motor nerve involvement. Other muscle-related symptoms include difficulty breathing, difficulty swallowing, falling, lack of dexterity, maybe putting a shirt and tie on or buttoning a button, loss of muscle tissue or shrinkage of the muscle, which is called atrophy, muscle twitching or cramping. So when a nerve doesn't fire from the brain through the spinal cord and out to the tissues it's supposed to go to, we're going to see a dysfunction there. We're going to see an end-stage dysfunction of those tissues. Now, the autonomic nerves control involuntary or semi-voluntary muscles, such as your control of internal organs, your ability to breathe, your digestive function. You might have constipation or diarrhea, difficulty beginning to urinate, dizziness, inability for the guys to have an erection or vaginal dryness in the women. So what we want to see is we want to make sure that we get the function back. We want to make sure that we increase the function of your body so that we can overcome the symptoms that you're experiencing. Now those are your chief complaints that you go to the doctor for. But we want to look at what's causing them, not just giving you symptom relief for these things. Now, causes of neuropathy. Some people, I put this slide up because a lot of people will say, oh, I hurt my back years or decades ago. Well, this leads to scar tissue, leads to spinal stenosis, or the holes as those nerves pass from the spinal column out those nerves and into the legs or into the arms. It can be caused by statin drugs, and your doctor probably is not even discussing this with you, or else he's just pushing it off and saying, oh, it's not a big deal. It is a big deal, because I want you to understand that what you might be taking could be worsening your condition. It can be caused by poor diet, it can be caused genetics. Genetics is 80 to 20%, 80% lifestyle, 20% genetics. So what your body is doing and how it's being affected is a big part based on what your lifestyle and what you're doing to yourself on a day-to-day basis. Now, statin drugs. Let's talk about statin drugs for a moment. Statins inhibit the formation of cholesterol. Okay, that's why you're taking the statin drugs. Your doctor wants to bring the cholesterol down. Cholesterol is used to synthesize CoQ10. Now, CoQ10 is necessary to generate ATP. Now, every cell in your entire body needs ATP to function properly. Now, human beings' ability to make ATP decreases about 1% per year after the age of 20. So as we look at that decrease in the ATP production, we can see that by taking statin medications, this can suppress the ATP production to the point where which neurons cannot maintain their electrochemical gradient, meaning they can't function properly. It's kind of like the pH in a pool. You're going to grow algae, or else you're going to have a healthy ecosystem in the pool when your pH is proper. But your body needs that CoQ10 to make sure that the frequency of firing of these neurons will not decrease. If the CoQ10 is decreased, then we're going to have a frequency of firing where the neurons do not support normal function. And this is perceived by the brain and results in numbness, tingling, and other symptoms depending on what nerves are being affected. Now, statin drug increases peripheral neuropathy 16 times. Now, this is a study from the Journal of Neurology, 2002, where we saw that the block in CoQ10 pathways, they needed more than 200 to 600 milligrams daily of CoQ10 to compensate for the statin drugs. So, according to this study, once again, we needed 200 to 600 milligrams of daily CoQ10 to overcome the effects of the statin drug. Now, this is the research article. Like I said, it's Neurology, 2002, May 14th, volume 58, 1321 to 1322 are the pages. So if you need a reference, that's what the reference is. Now, diabetes and neuropathy is very, very important because so many of our children, so many of our adults now are being diagnosed with diabetes. Now, insulin is a hormone produced by the pancreas to control your blood sugar. Now, diabetes can be caused by too little insulin or insulin resistance or too much or both. Diabetes can lead to neuropathy. Now, all chronic conditions seem to have some of the common threads. We've got fibromyalgia, we've got vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy, restless leg dystrophy. We've got rheumatoid arthritis, chronic neck pain, stenosis, hypothyroidism, irritable bowel disease, insomnia, and digestive disorders. Now, all of these conditions have shown in research to be oxygen deficit, to have a neurological misfiring, to have metabolic imbalances as far as the blood chemistry, including blood sugar, your cortisol levels, your hormone therapy, your anemia. If you have that, these are all deal breakers. You're not going to get well if you leave these things unchecked and out of sequence as far as with your body's dynamics and how you're functioning. We want to make sure that we have balanced brain, left and right brain. We all know that the right side of the brain will control the left side of the body. Left side of the brain will control the right side of the body. So that's what we do, is we do take a special interest in the neurology and how your body is working. Now, this is a brain map. Different areas of your brain will control different functions. We've got the frontal lobe, that's where most of your personality is, your emotions. We've got the speech that's in the temporal lobe. We've got your skills, your sensations in the parietal lobe. Your vision's back in the occipital area. And your cerebellum is in the back half of the brain as well. That controls all your coordination, your balance, your ability to move with specificity when you go through to reach for something, or you go through and do tests like touching your finger to your nose or finger to finger, or different balance tests that we do in the office. Now, what we want to do is we want to make sure that as we help you with peripheral neuropathy, that you will understand that this is a life-changing event. We want you to understand that you have to take personal responsibility for your condition, because without personal responsibility, then nothing else is going to matter, because you're not going to succeed if you don't follow the recommendations. Now, have you been told that your lab tests are normal, but you still feel horrible? Well, lab ranges are inaccurate. These take on a bell-shaped curve, and within that bell-shaped curve, those are the labs that your doctor sees on the lab report. What we have to understand is that each end of that bell-shaped curve is actually where the sick people are. They're extremely high or they're extremely low. What we want to do is we want to look at the functional aspect where the healthy people are. We don't want to look in and compare ourselves to those sick people that are out on the ends of each one of those scales that the lab sends out. So what we do is we use a functional scale. We use functional assessments with looking at your blood test. Now this is an example because as we look at a lab test, our healthcare model, we're looking at the functional range here to here. Your doctor, when they evaluate you, they look at the lab test from here to here. So abnormal low lab values are all the way over here. And abnormal high values are all the way over here. We want to look at that functional range. We want to look at where the healthy people live. And that's where I want you to be. I want you to be within that optimal group. It's not about just saying you're within a big group and you're going to have catastrophic problems if you're way over here or over here. We want to put you into a healthy group. And that's the difference also with your eating. We don't want you to be going to the fast food restaurant and saying, okay, well, I'm eating a healthy diet. So there's one clue that I'm going to talk to you about more in depth when we do an in-office workshop with you. But now this next slide is very, very important because, for example, if you have decreased thyroid function, we're going to see that our functional range is 1.8 to 3. We're going to see that the lab results that your doctor gets back from the lab, it's going to give you anywhere from 0.3 to 0.45. That is 0.3 or 0.45 to 4.5. And so it's a big, wide range. We're looking at 1.8 to 3, not 0.4 to 4.5. Now, I don't want to confuse you too much, but when we are outside of those levels, those are not optimal levels. So another system in your body can be affected by those abnormalities. But once again, more specificity. We want to make sure that we provide you with optimal care. And the way that we can get you optimal function is by providing you with optimal analysis. We're not looking at just one system and saying, okay, we're going to treat this symptom. We're going to look at you as a whole person. Now, some critical areas that are important when we look at peripheral neuropathy is anemia. We're going to look at blood sugars, and we're going to do an adrenal stress index to help you evaluate the cortisol levels in your body. You have to understand that when you go to bed, we want those cortisol levels nice and low. When you wake up in the morning, we want them nice and high. But if your cortisol levels are high in the evening when they should be low, you're not going to be sleeping very good. Also, it's going to affect your blood sugar. Also, it's going to affect your cholesterol makeup. So we want to make sure that we address things properly. So one is anemia, it's a deal breaker. Blood sugars is a deal breaker. And then we want to look at your GI tract or your liver function. We're going to look at both of those in combination when we go through it and we run a complete metabolic panel, a complete lipid panel. We'll get those areas involved. We're going to also run a special test if you become a candidate in our office for care. We're going to also look at fatty acid metabolism. Now, all of these areas are critical, and if we have to look at each and every one of these, we want to make sure that we sit down with you, we discuss what the importance of each one of these tests are, and we want to make sure that we can help you get back to normal and understand what your responsibilities are from a lifestyle change perspective. Now, we're going to do a comprehensive neurological workup and a comprehensive metabolic workup. Neurological tests that we do is we're going to do right and left blood pressure. Most of your doctors probably just take it on one side. You've got two sides of the body and they can vary. Tissue oxygen saturation. We're going to check that with you. We're going to check your heart rate and rhythm. We're going to do a saliva pH test. We're going to check your reflexes, your eye movements, which is very, very important as far as with overall normal brain function. These are functional tests that your doctor probably, and 99% of the time, has not done. Some of the neurologists, I'm sure, have done that possibly. But we're not going to look at one thing. We're going to tie everything together into our assessment with your condition. We're going to also look at cerebellar tests. Like I said, your cerebellum controls all your postural muscles. Very, very important as far as stability, very important as far as brain function, and that right brain controlling the left side and the left brain controlling the right side issue that I brought up earlier. We're going to look at metabolic tests. This includes the blood sugar levels, your adrenal function. We're going to look at cortisol levels. We're going to look at thyroid, cerebellar antibodies. If we need to, we're going to take a male or female hormone panel. And we're going to also look at food sensitivities. Do you have leaky gut? Are you having a problem with gluten? because very often we see that the gut is going to affect the brain is going to affect all tissues. And as we see inflammation rise, we're going to see a decrease in function. As we see inflammation decrease because the gut system has been restored back to normal, it's a normal ecosystem, meaning that just like your pool, the pH is back into normal range, the gut function is going to help you assimilate nutrients throughout your body and properly, to keep the blood sugar levels down, to keep the cortisol levels down. So there's a cascade of issues that come up when we look at the GI tract. Now, the next thing I want to discuss with you is that when we treat the cerebellum and we look at brain function, the cerebellum and brain requires two things in order to properly function. We need fuel, and that comes in the form of glucose from the foods that you eat, and we need oxygen. So that's a fuel source. Fuel and oxygen is your fuel source. Now the fuel is glucose from the foods that you eat, and if we're eating a bunch of fast food, or we're eating a lot of gluten and we're sensitive to that, we're not going to get the fuel that our body needs. The next thing is activation. We do unilateral, one-sided adjusting with you so that we can specifically address that left to right brain issue that I talked to you about a little bit earlier. Now, when you come in the office, we'll describe exactly what we do, and I'll show you a demonstration personally on you so that we can show you how that system works and whether or not it's working for you. So everything is brain-based rehabilitation when we look at our care here in the office. We look at metabolics, we look at your nutritional aspects. So metabolic and nerve function, it's all tied together. You're not just a bunch of parts like a car, and we can't treat you like that. And unfortunately, that's where healthcare system has come into, is we're looking at people from different systems not working together. We're not looking at the whole body. Now, we use a number of therapies for brain activation. We have vibration therapy. We'll put it on either one side of the body, both sides of the body, whatever the neurological findings are, and what we need to address with you in particular. We use gentle chiropractic adjustments. As I mentioned, we do it on one side or the other. And our therapies are based on our neurological findings. So we're not going to just pop your spine, which most chiropractors don't just pop the spine. It might seem like that to a lot of patients, but it is a meticulous, a regimented, and research-based therapy that is extremely effective. Now, next thing we're going to do is we're going to use an upper body ergometer. We're going to have exercise with oxygen therapy. We can do mirror imaging with you. We might do spin therapy to affect the cerebellum, and we might be using olfactory or the sense of smells to help your brain start to function properly. Now, each one of these therapies is very, very important because, as with the upper body ergometer, we're moving joints and we're moving muscles as we cycle that bike. And as we cycle that bike, we're moving joints and muscles of the rib cage, we're moving the shoulder, we're moving the majority of the nervous system, which is from the rib cage on up, which will give you a higher stimulation to the brain's increase or decrease in function. So if we can cater to one side where you have a decrease in that function, then we're going to affect that opposite side of the brain and bring it up into a normal activation. So that's the therapy that we use there. Regarding auditory stim, we can use music, we can use an interactive metronome, we use auricular therapy to stimulate those different areas as well. Those are actually acupuncture points. We might use a warm caloric, which is where we'll use warm water to affect the inner ear. That in turn provides a lot of stimulation to the cerebellum, and we can help once again increase activation of those pathways. We will also use visual stimulation, and we'll use different imagery. So those can include your checkerboard pattern, faces, colors, eyes, words with large letters with small letters, large letters with small letters, or small letters with large letters. So we want to make sure that we want to specifically affect those different areas that are involved in your case. For nerve activation, we want to utilize what we call a health light or a rebuilder system. And within those systems, we're able to help upregulate the tissues within the feet and in the hands so that we can get normal function, normal metabolism back out of those tissues. So it's kind of like a jump start, and we kind of jump start the nerves back in your hands and your feet so that we can get the body circulation going. We can get the ATP built back up into the body in those areas that have been damaged. We want to make sure the mitochondria, which is a small area of the cell, which is a powerhouse, the mastermind of each individual cell, we want to upregulate that and make sure that we're having normal function once again with you. Now, all cases of peripheral neuropathy and chronic conditions for that matter are a combination of both neurological treatment and metabolic treatment. So metabolic, approximately 40%, neurologic, 60%. And as we go through those cases, the brain hemisphericity that I talked to you about, where we're looking at left and right brain, is very, very important, because if we have misfiring with the metabolic complications, we can see that your blood sugar is off, your cerebellum's off, cortisol levels are off. We can see that you have oxygen deprivation, maybe your overall oxygen levels aren't where they should be, and we have dysfunction of the midbrain or of your hormones. Now, as we provide you with care and we correct that underlying cause, then what we're going to see, and my screen's here taken off on it, we'll have to do periodic retesting to let us know if we're on the right track, so we can bring the picture together. Once again, it's not looking at all different parts of the body, it's looking at your body as a whole. Now, we treat the whole person by bringing all the pieces together at one time. And that's the very, very special thing about our innovative care, is that we're going to look at you as a whole person. So what will happen in the first 2 visits of your care with us? The first visit, visit 1, we're going to do a complete peripheral neuropathy examination. We're going to also do a review of your existing blood labs that you will be bringing into us. We'll review the metabolic assessment form and the neurological assessment form and the neurotransmitter assessment form that we will provide for you. And it's a good idea always to bring your spouse. I always like spouses to come to our exam and also to the reported findings. It's imperative that they come to the reported findings. In fact, we do require that. And the reason why we require that is because we want the couple to be on board. Like I said, there are some lifestyle changes that are very, very important that are taken on, and it's much more successful if everybody's on board with the recovery. Visit 2, we're going to review the exam and neurological findings from our initial consultation and examination. We're going to review the assessment forms that we've provided for you. And I'm going to let you know if I accept your case. Now, I want to be very, very honest with you. If you're not a candidate for my care, I'm not going to accept you as a patient. Okay? This is very, very important, because it's not about you coming into the office. It's really about my ability to help you and feel confident that I can help you with your case and with your condition. Now, we're going to do an overview of all the treatment plans when once we do accept you, if you are a candidate for care. We're going to review the financial obligations, and once again, we do require the spouse to be present, because we want everybody to be on board, not only from a commitment standpoint, but also getting the labs done and making sure things are done in a timely manner so that we can be the most benefit for you and your recovery. So we've got 5 key questions. And the first one is on a scale from 0 through 10. You have to ask yourself, how would you rate your desire to actually get well? And how much would you rate your ability to follow through with care? So how has peripheral neuropathy symptoms affected your job, relationship, family, your ability to enjoy life on a day-to-day basis? If it's decreased, I want you to take a second look at our program, because I will sit down with you, I'll be very, very thorough with you, and I want to make sure that you can live your optimal wellness. And as we go through and we look at the other things that can affect you, what does it cost you in terms of time and money and happiness and your ability to golf again, your ability to go shopping, your ability to hold your grandkids. So all of these are big factors, and people sometimes don't evaluate what it's actually costing them to be sick. Your productivity at work, your ability to work. If you don't do anything about this, where do you picture yourself in the next 1 to 3 years? When things are going down, we're not going to see a change unless you do something, you have a change in your habit, your lifestyle, or the therapies that you're taking on to correct the underlying causes. And that's what we always want to do, is we want to make sure that we address those primary causes of why you're sick. Next one is, what is it worth to you if we could improve your condition? Well, I'm going to be upfront with you. Our evaluation, we're going to make that very, very reasonable for you. We're going to recommend some supplementation for you if needed. We're going to do some in-depth tests that your doctor probably has not done with you. In fact, I'll guarantee he has not done them with you if you're still suffering. Very often we see that from a medical perspective, it just goes back to drugs and surgery. It doesn't go back into where and why are we having the problem. It's just putting one Band-Aid on and then another Band-Aid on. So you might be taking statin drugs for the cholesterol, you might be taking Neurontin or another medication for the pain. Once again, it's a patchwork system, and unfortunately that's the reason why our healthcare system's in the disarray that it's in, is because we're not treating people with the core cause of why they're having problems. We're putting a lot of Band-Aids on it, and a lot of people are profiting from that. But I want to empower you to make a change with you. I want to empower you to make sure that you enhance your quality of life. So what's next? If you or someone you know has peripheral neuropathy or another chronic health condition and you would like an evaluation in our office, I want you to call and schedule an evaluation. Now this evaluation is valued at over $250. It consists of 12 screening tests. We'll have a neurological assessment form, we'll have a metabolic assessment form, and I'll sit down with you and we'll review your pre-existing lab work also. So we'll find out exactly what we need to run if you don't have the regular lab work that we require. So we're going to offer this to you for $69. If you'd like to make an appointment, I'd like you to be your own lifesaver. Now this is a life raft we've given out to you, and all you have to do is call us at 714-730-5833. My front-end staff would be more than happy to talk to you about your condition. They'll set you up for one of our workshops that we do. It's regularly in our office. Or else you can also check us out on the web